a day I was in the clinic with a consultant and some of my colleagues, and we had a patient come in. It was a very touching time for me because we had a patient come in. The patient, well, the parents of the patient was just about 5 months or so. The patient had cerebral palsy. Now, when the patient came, when they brought in the patient, and then we saw the patient, usually in medical school, you'd hear things like, the only thing that we'll be able to do for this patient is like supportive care and therapy throughout their life. So we're talking about things like aided education, aided developmental exercises, and things like that in order for the person to have at least a better life. We all know that in Nigeria and Africa generally, people are not really accepting of people with disabilities.
Yeah.
So it's very, very difficult to live and go through. So it's always it's always a terrible time for the parents whenever they have their children with that. I mean, it's not something that it's easy to live with, if we are being very honest. So the patient came in, and then the consultant, a very seasoned pediatrician. Now we're hearing the normal things that we knew from our textbooks and what we see in the clinic every day. And then the consultant said something that really struck us. He was like that there was a man, a Pakistani neuropediatric surgeon that was working or had new research done on some surgery, a cranioplasty procedure or so that could help regenerate the because we see cerebral palsy as something that is non-reversible. So he said that it was actually reversible, and that's what the man was working on. And then he has had some
that's interesting
trials. And we're like, oh, in medical school, this was like, it's big news. And we were wondering, how come we never heard about this? So immediately he said we should get on Google, and everybody was on their phones, and they were trying to look for, his name was Dr. Islam Chowdhury. And we all started looking. And then we could not find anything on Google. And it was so surprising to me. And I was wondering, and how come this kind of thing has happened and then we can't find any material or resource on it? That time I just started my LinkedIn journey. I decided to take LinkedIn more seriously that time and look for how I was going to use it to buffer up my career, like what I was doing, because I was still at the initial phases of building Docxplorer that time. And I knew the capabilities it had for any professional, especially in healthcare, because of the basis of what we're doing. So even now, we make LinkedIn a priority social media platform for communication and community building for all our participants. That's why we have a course called LinkedIn Optimization for Medics 101. So we're already in the third edition already. So I said, something just told me, let me just check LinkedIn. So I opened LinkedIn and I came across some material on what he had done. He had a very, very bland LinkedIn account. It was not optimized. I think he just had about 20 connections or so, but then I knew it was authentic because I saw some of the journals or links to the journals to what he had done. So after that experience, I sat down for a bit. I was almost like in a trance for like 20 minutes. I was thinking and I was wondering, how come with all the work this man had done, he didn't have any sort of visibility? There was no record about all these things. And you would find so many things that are not necessarily that useful available on the internet. And I was so surprised. Then that's when it struck me that something needed to be done in terms of visibility and knowing how to sell yourself as a healthcare professional, especially as a healthcare professional with innovative ideas that can help people all around the world, because there were so many people couldn't care about that. But because of what I did, we're able to find the man's contact, and then at least if something could be done, let's take the chance. So that just made me think, and I just knew that it was just something big. Most medical students and healthcare professionals usually get this wrong in terms of knowing how to build themselves, the career path to follow, and everybody thinks it's just a straight line. And or you just imagine, oh, I want to do this in the future, without preparing, developing the necessary soft skills that would be applicable in reaching the heights that they think they want to reach in their heads. And that's when I said we had to create something that would help people with their journeys, with knowing how to do the right things, to prepare yourself for the next level, for the next level. So if you're saying you want to do public health, how about us getting you on board with some mentors that have gone ahead in this, learning about what the career life looks like, knowing how to grow the network and build generally. So all these things put in place together, we just said, well, we need to create things. So we have things like trainings, courses that were going to help us to organize and integrate everything for a professional, for a student, in order to grow. So that's how we just put everything together, and then that's how we started.
Wow. Okay. See, what you're doing, and this is what I found since I started this podcast. A lot of people I talk to are doing things that are uncommon in our environment. And that's what makes me very happy, because it shows me how innovative you are, you know, and that we have young people and people about my age who are taking advantage of the kind of information that is out there. You see, I personally believe that yes, first of all, we are behind, okay? And I need to say that because we have a lot of people who like to think that if we say the truth, that we are making ourselves inferior. No, the truth is that we are behind, and we need to acknowledge that so that we can know what to do to catch up.
Exactly.
And you guys are doing a lot of things. See, you see, Africa is taking advantage of these different new technologies and running with them and doing things that nobody else has done before. Okay, M-Pesa in Kenya is one of such. Okay, using the mobile phone to advance banking for ordinary people, you know. And what you're doing, uh, it's something that will benefit a lot of young medical professionals. Okay,